Social movements as a catalyst for change. What a great topic.
So have I got some slides?
I don't know. Oh, it's
Very
back again.
good.
Yeah, look at this.
So sprinkle the fairy dust, no pressure there then.
So
Social media
sprinkle
magic.
fairy dust for us.
I'll tell you what, you've got a really good hashtag to start with, AHPs interaction, isn't that what it
No,
says?
actually it says AHPs sin to action.
You had to do it in the right place, yeah. So, that's meant to have a massive drum roll, okay? So, luckily I haven't got any film. It's always good to check with the sound at these events. So that's a massive drum roll, AHPs interaction. It's what it says on the tin. So how do we spread the magic? Okay, well Suzanne only really asked me last week to do this, and I said yes, and I've got this thing about you kind of say yes and learn how to do it later. So how do you do that? Well, typically you might phone a friend. You might, this slide hasn't come out properly, it doesn't matter. You might phone a friend and the friend might say, sorry Jill, no idea on that one, or they might be out. But that doesn't happen on Twitter. On Twitter, you ask and you get answers. So I put this up straight away on Twitter, and my friend Melissa said, well, you start with your why. And that's something we're using really strongly in a campaign called Cov Mind the Gap. Take a look at that campaign, it's fantastic. So my why, I've created a board game called Who Shoes. Now why on earth would you do that? Because I was frustrated. I was frustrated that basically all the answers are in the room and we never listen to real people. So I get people, everybody, break down all the barriers, get together, and you'll find that if you really listen to people, and that involves creating the right conditions, they'll come up with the answers. So Kath Evans said it's all about shared purpose. I agree, Kath. So Joanne came in, and I've got something covering what Joanne said, but it's about an unfaltering commitment, people working together and finding their why. Is that pretty much it, Joanne? Can we get rid of that box, Ralph? Oh, I've got it on my screen. I've got a little box saying a WebEx meeting's in progress. Never mind. It's all about doing our best for patients. Do you know who these patients are? Well, actually, they're people, kind of all of us. So you've got a really great list here of commitments, but to be honest, at the moment, it potentially looks a bit bullet pointy to me, and that's a real shame because you need to bring that into action because it's fantastic. So to take one example, commitment to keep the carer closer to home. Now I've started a little Twitter poll live to see whether people would rather be treated at home. So far it's 100%. So AHPs interaction, let's take just one of those examples. Okay, so storytelling. We've heard about 3 case studies today out of apparently 53. How many stories are there in this room of innovative things that you people actually do day to day to make people's lives better? You need to share those stories. So this is a little story from me. People sometimes see me tweeting with my mum, Jill's mum, and OTs I'm very grateful to because thanks to an OT assessment my mum didn't fall and she settled very well into her new accommodation. But sadly, she became ill and she had to go to hospital. And the NHS does what it does so brilliantly. It fixed my mum medically, but then for the first time she really needed a care package. And she started to fall into this outliers, bed blockers, oh my goodness, and I wasn't very pleased. So I launched a campaign, not consciously, but it kind of happens sometimes, called Free Jill's Mum. And I've got 20,000 Twitter followers, but in addition to that, I write Stella stories. I don't know who's heard of Stella stories. You need to use them because I got 40,000 views in the first 2 days, and my mum got a very nice care package and came home quite swiftly because things have never moved so fast. So sometimes you can build a social movement from nowhere and get your mates on board with their Mongolian armies and their Ukrainian soldiers and coloured elephants and all sorts of things happen. Take a look. So this was last weekend. I like to make my talks topical. This was somebody talking about blamestorming. Okay? So an example of how you can take something colourful and make something happen all over Twitter. So who's at fault for the NHS crisis? The bloody phlebotomists. They're literally bleeding the NHS dry. Okay? But don't laugh too hard because you people didn't come off too well either. I blame the OTs, they're getting people home, only for some of them to come back into hospital eventually. What are you thinking of? The paramedics, they caused this crisis, cut their pay unless they agree to leave people where they find them. So it goes on. But the particular reason I wanted to bring these in was, look, their blamestorming hashtag is being used powerfully. And if you made the same funny point but didn't put the hashtag in, they'd kind of be lost along the wayside. So use your AHPs interaction very, very powerfully. Share stories, share good practice. So this is Cov Mind the Gap. It's outrageous. We made it grow from nowhere in Coventry because fantastic people are doing fantastic things, bridging the gap between services and what really matters to people. So please take a look at that. That just gives you an idea of the kind of colourful vibrancy that you can build. This is one of our Who's Shoes workshops. We put it together from nowhere and we had the apparently hard to reach people queuing at the door. Are they hard to reach? Perhaps less so. And that's my mum grinning away in the middle there, completely outside her comfort zone and loving every minute. She's 94. So what matters to people? You people do. You can bridge that gap. You've got an incredible opportunity here. Social prescribing, would you be wanting those things on the right? Would you be wanting to dream of how you can make your life as good as it could be? I suggest we all do. So I think I'd probably be lynched today if I didn't mention MatX and Wear My Necklace. MatX has been incredible and grassroots campaign really. Everybody joining together, no hierarchy, just people, improving maternity service. We use a lot of fun. People ask where the lemons came from. Probably to actually tell you, it's a funny story, but it's not as funny as people just not quite knowing and having a bit of intrigue. The fundamentals of building a change platform. So there's our MatX hashtag. 600 million Twitter impressions. That's an awful lot. But the thing I'm most proud about is we've literally had 1 million Twitter impressions a day for over a year. And that's unusual and it's consistent. That's how you build a change platform. So Roy said we met last week. I was launching my negativity bingo because language and poor language has been right at the heart of MatX and consistently. So we're trying to make more about it because really if I tell you that you've got an inadequate pelvis or you've got an incompetent cervix, especially the men, then you might not be that thrilled about it. So I did ask Simon Stevens, the Chief Exec of the NHS, how he'd feel if he was told that he'd failed to dilate. And he grew a beard afterwards, and people said he was trying to avoid him. I'm not sure if that's true or not. So last week, this was at the Do-a-thon, and we launched Dump the Daft Words. And this is Neil Churchill, patient experience lead for NHS England, very good sport, and he was wearing a patient operating theatre gown to, I think it's all about it's walking in each other's shoes and learning what it's like to actually be vulnerable. So language, just do it, use all sorts of different methods, use storytelling, use everything that you can get hold of, and JFDI, that flashed up, I don't know what that was. So I'm actually at the top of the nursing and midwifery social media ratings. I'm not a nurse, I'm not a midwife, I'm only including that because I'm just showing you that anybody can do anything. There I am, and there are you. You're all transforming health and well-being together. There's your hashtag. Just do it, sorry. Just do it, believe in yourself, do one thing, do something different, and make it happen. Thank you.
Oh yeah, what were they for, Gill? Because you've given us all like that.
I've given everybody a paper chain, and the idea is that you don't have to join them in one linear way, you can do it any which way, the colours could represent different professions, but you need to all connect together.
Can we all do it in the bar afterwards?
We could, yes.
Yeah. Can I help you down? Thank you very much. Good. That was terrific. Thank you so much, Gill. That's great. I had the great privilege of watching Gill in action after last week at my do-a-thon. She had a hugely successful. We're writing in what? We're going to publish it.